My name is Mohammad Rafi Hassan. আমি এসেছি হচ্ছে ঢাকা থেকে। The reason of my arrival is আমি হচ্ছে বেসিক্যালি খুবই আনসার্টেনলি একটা অ্যাক্সিডেন্টে পড়েছি। সো অ্যাক্সিডেন্টটার মেইন রিজন ছিল হচ্ছে যে আমি ঘুরতে গিয়েছিলাম, ওখান থেকে জাস্ট আই গট ফেল ফ্রম আ টুকটুক অথবা সিএনজি। তো পড়ে যাওয়ার পরে যেটা হচ্ছে সাডেনলি আমি আবার ACL লিগামেন্টে টর্ন হয়েছে আর মিনাসকাসে ইনজুরি হয়েছে। ভেস্থানি চুজ করার কারণ হচ্ছে আমার যে এটার কিং অফ বোনস। আই হার্ড লট অফ থিংস অ্যাবাউট দিস অ্যান্ড আই অলসো গট রেফার্ড বাই মাই ফ্রেন্ডস। তাছাড়া হচ্ছে আমার ফুপ্পাও এখানে ক্যান্সারের ট্রিটমেন্ট নিয়েছিলেন। সো ফার আই হার্ড লট অফ গুড থিংস অ্যাবাউট দিস হসপিটাল।
This patient already did ACL reconstruction on 2019, and for last December is about 6 months. He had injury again about his knee, and after that we found that he had painful and unstable of the knee and come to see me.
So basically he suggested me to do an MRI and X-ray at the initial stage. After that he showed me the report and explained it to me that where I do get the injury and how we have to treat.
After we do examination and take history and do MRI, we found that he had retorn about the ACL graft and also had the last torn of the medial meniscus of his knee. Okay, this is the MRI of his left knee before surgery for the planning, and this MRI showed that this is the old ACL graft that the only torn at the mid substance. This is the old school, and another view we can see the medial meniscus that torn. This is the meniscus that torn totally and displayed into the interarticular joint. In this height is called the bucket handle type. It's the last torn of the medial meniscus of his left knee.
I was pretty much convinced with their professionalism and with their knowledge and the things I see around, the way they approach the patients and vividly describing the whole scenarios with patients. Those are outstanding. That made me believe that yes, I can do my surgery here. And he also told me about the arthroscopic surgery, and he gave me a plan, an image of the total thing.
After we discussed with the patient, we plan to do the arthroscopic revision ACL reconstruction with hamstring graft, contralateral side with repair medial meniscus of his left knee. Nowadays, the revision of the ACL reconstruction is standard and is a minimal invasive. So we plan to do the minimal invasive because he can recovery faster than open that compared in the past, and good option for him because he's still young and want to return to play football. So we decide to revision ACL for him to make his knee stable and decrease the pain, and meniscus repair is very important for him. Before this surgery, he already used hamstring graft for the left side, so we decide to harvest the hamstring graft for contralateral side, and after that we use this hamstring graft to be the new graft, and we will need to repair his meniscus that we will show you again in the picture. For arthroscopic surgery, we found that his medial meniscus is torn and last torn is bucket handle. After we reduction of his medial meniscus is still unstable like this, it torn all of the meniscus. So we decide to repair the meniscus because it's unstable and his condition still good. Luckily, we can repair meniscus with a good stable. And this is the ACL graft, old one that already torn and still had the blood dry, now laxity, and we do the revision reconstruction with the all inside technique. And this is the new ACL graft that we already done to replace old graft that already torn. Now when we do the full extension, and you can see the graft is not impinged with the notch. So this is a good position, and we're very happy with the operation.
So first 2 days I have to stay in the ward or cabin. The quality is world class and outstanding, honestly.
And this is the X-ray post-operative because we use all inside technique. You can see the button. We need to check that the button is very good position, and we can see the good position of the ACL that we revision and reconstruction here. This is the operative surgical wound immediately about 1 week, and after 2 weeks, everything will healing like this. The wound we had a very small 1 centimeter and 1 inch at his left knee. See the good condition of the wound after he follow up at our patent clinic. There is no complication about the wound. The swelling decreased very well after we did the good physiotherapy, and he used the knee brace to protect his left knee and make him recovery with a better result at 2 weeks post-operation in this picture. The function of the right knee is very well. When he comes to see me at 2 weeks, he can walk with crutch very well without any complication. The result of the repair meniscus that is better than meniscectomy or partial meniscectomy, and about his reconstruction we need to use another side of the graft, so this is a challenge about the revision operation. I'm very happy about the result of the operation, and after follow up him for 1 month, his clinical is very stable and recovery is very fast.
So the doctor basically told me to get the therapy constantly, continue it till the 6th of the weeks. Basically, he told me to do some exercises by myself and to be in contact with him, and if possible to come back after 3 months to have a recheck.
Because he needs to return to his home country, he stayed with me about 1 month. At this period, he can walk without crutch, but he needs to continue to do the physiotherapy to regain more range of motion, more strengthening, and we will see in the future.
He told me to have crutch until 6 weeks. Then maybe I'll be able to walk without the help of brace and crutch.
Because of the repair of meniscus and do ACL reconstruction with the same time, at this period, he needs to regain range of motion a little bit time by time. If he to return to sport or do something not in the protocol of ACL reconstruction, the graft and the meniscus that we repair can re-injury and re-damage. So we recommend him that when he come back to his home country, he need to persistent to follow the protocol strictly, because if he do more or less of the protocol, the complication, return of meniscus or repair ACL or knee restriction, stiffness can occur. So very important to follow the protocol that we give to him and follow at 2 months, 3 months, 6 months and 1 year.
Alhamdulillah, surgery successfully হয়েছে. So far everything is good, and I hope that যে আমার full recovery টাও after 6 weeks ভালো মতন হবে, but maybe I can walk by myself after 3 months completely without any support or help. That's what আমি expect করি আর কি. The doctor is an outstanding guy without any doubt, and he is one of the best arthroscopic surgeon as far as I know. I do have experiences of বিভিন্ন কয়েকটা হসপিটালের আমার medical treatmenটের experience আছে in Thailand, but so far I feel Vejthani is better than those, especially in terms of professionalism. Vejthani is pretty good.